Hello, Michael. My name is Irina, and I'm going to be the nurse performing health assessment today on you. We're going to be checking your lungs, your heart. We're going to assess your breast and also check your vascular and lymphatic system. Is that all right?
Okay.
Okay. I would like to ask you first couple of questions. Do you have any allergies?
No.
No, you're not allergic to latex, any medication?
Nope.
No, all right. Do you have any? We're going to be assessing your lungs first, so I'm going to ask you a couple of questions about that. I saw in your chart that you have asthma. Is that correct?
Yes.
All right, and it said that it's exacerbated with the coldness. Do you have any problems breathing now since it's winter time?
Not at the moment.
No, you're good. I'll observe your respirations and I see that they unlabored. They are regular. Seems like your chest expansion is symmetrical. We're gonna assess that more closely. Do you have any shortness of breath, especially on exacerbation when you like exercise or run, walk?
No.
No. All right. So we're gonna look at your back first, assess you from your posterior side. If you don't mind to turn around for me, thank you. All right. And I'm gonna, all right, sit straight. I'm gonna assess his chest. His spine seems to be straight, and lungs, the upper thorax appears to be symmetrical bilaterally. So skin and touch, I'm going to be touching you, Michael, all right? So you get used to it. Skin appears to be warm, soft, and dry, as you have some acne on your back. Are you on any stress right now?
Yes.
Yes. Do you go to school?
Yes.
You do? College?
Yes, ma'am.
All right. Now it's the middle of semester. It starts to be a little bit hectic, so I can understand that. Just keep it clean and dry, and so you don't get any infection in it.
Okay.
All right. I'm gonna check expansion of your chest. I'm gonna put my hands on your back and pinch a little bit skin here. And can you inhale and exhale a couple times really deeply?
Okay.
All right. We see chest is expanding symmetrically. So that's good. I'm gonna palpate lightly kind of your upper tissues to see if there is any lumps or anything. Do you have any tenderness anywhere?
Not at the moment.
No. So when I'm palpating, you're not really feeling anything?
Pain-wise, no.
All right. I don't feel any lumps, so that's good. I don't see any lesions otherwise. So we're gonna continue. I'm gonna check for vibrations in your chest, in your lungs. I'm gonna put my hands on several places, and if you feel touch of my hand, you're gonna say word 99. All right? Go ahead.
99. 99.
A little bit louder.
99.
Good.
99.
All right.
99. 99.
All right, so vibration in his lungs appear to be symmetrical bilaterally, so that's good. Now I'm gonna percuss your lungs, all right, for the and feel a little bit here, all right. All right, his lungs appear to be resonant, so that's good. I heard some dullness about the visceral areas. Michael, I'm going to check for the tenderness in your area where you have kidneys and some other organs, all right? I'm going to hit a little bit on my arm. It shouldn't hurt, so let me know, okay? Do you feel any pain?
No.
Okay, very good then. All right. I'm going to listen to your lungs. I'm going to auscultate a little bit with my stethoscope. All right, I already cleaned it with the alcohol. So I'm going to listen for your breath sounds. You go ahead and just breathe normally for me, all right? Okay, I hear bronchovesicular sounds. I don't hear any wheezes and expiration, so that seems your asthma is controlled, well controlled now, so that's good. All right, if you want to turn around from front for me, I would normally perform the same assessment on the anterior chest wall. I'm not going to do that now because we pressed a little bit by time, but the assessment would go pretty much similarly to the posterior side. I'm going to assess your breast, Michael, because even though you are a male, I consider that very important assessment. Even though it is not as well recognized, 1% of males dies of breast cancer, so it is important to do breast self-examination even for you. And we're gonna again assess the also vascular system with it, his lymphatic nodes in the axillary area, since the breast drain to that area. If we were going to check for any tenderness and enlargement. All right, his breast seems to be nicely symmetrical. Skin is again soft and warm. I don't see any lesions. I don't see any retraction, any dimpling. Did you ever notice any discharge from your nipples?
No.
I would normally check for the discharge of the nipples. I'm going to ask you to raise your arm above your head like that. Very good. All right. And breasts look symmetrical. They raise up symmetrically. I don't see any fixation. Now put your arms on your hips like this and lean forward. All right. That in a female also we're going to be assessing for the symmetricity and any lumpiness on dimpling. Okay, you can go straight back. All right. I'm going to palpate your breasts now. I can do that and also you can learn that from me. You can do it in a rotary pattern. You also can do wedge pattern, or you can do it in vertical pattern, up and down. All right. I'm going to go with the rotary pattern. Seems to be working the best for me. So I'm going to be touching you and palpating you a little bit around. I'm going to palpate around your nipple. All right, and we're going to do both breasts. I'm not noticing any gynecomastia. Since this is a young male, sometimes it can happen that young males, they have enlargement in the breast tissue. I didn't know that any on you, but that is benign and it usually resolves itself. It could be unilateral or bilateral, but you don't seem to have that problem. Some young males do. So we also check for that. I didn't felt any lumps or any fixation, so that's good. If you don't mind to raise your arm like that, I'm going to support your arm and I'm going to palpate the axillary area and around upper outer quadrant, which is the quadrant which usually has the breast cancer if it appears. So I'm going to palpate for those nodes. Hope you're not ticklish. I'm going to palpate the upper arm around the lymph and in the posterior area and mid-axillary. All right, I didn't feel any there. We're going to do the same thing on the other side. I'm going to palpate the tail of Spence. All right, I don't see any nodes enlargement. That also means you don't have any infection. That's good. All right, I would like to educate you a little bit. How can you perform? You just observe me, what I did about the palpation. It's easy to do, maybe once a month. You can do that in a shower when you have wet, soapy fingers. It's easier, they slide under skin easy. So go ahead and do the same palpation. Would you mind to show me how would you do that? I mean, what did I did? Do you go like around? Yes, very good. That is good. Yeah, go in the circular motion and also check under your arms. If you find out any swelling or any enlargement under your arm area or any like hard fixated lump around your breast or any discharge from breast, you immediately need to go and notify your primary care doctor, all right?
Okay.
All right, that would do for today's physical. Due to time, we would later perform your heart and, like I said, lymphatic and vascular system assessment. For right now, I would like to do a little bit of education since you have asthma. I know that in your chart that you use non-nicotine vapes, mainly like a hobby. Do you still do that?
Yes.
Yes, you do. How often or how much you do of that vaping?
Just here and there, just for fun as a
For
hobby.
fun, yeah. Hobby like that, it could prove dangerous in years. We don't have enough research done on that, what kind of a damages it can cause to your lungs. Some of those companies, they use chemicals which they cause, it's called popcorn lung. You might want to consider just changing the hobby.
Okay.
That would probably be a good idea because we don't know what it costs. It's an oily film which is coating your lung inside with the vape together. I know you said previously that some companies are more safe, some not, but we don't have enough regulations on that. Who puts what in those juices, what kind of chemicals are in. So I would prefer for you if you not do that and if you change your hobbies.
Okay.
All right.
I understand.
All right. Okay, Michael, I appreciate your time today.
Thank you.
And I will see you on the next assessment. All right. Thank
Thank
you.
you.